do your introductions. So hi, everybody. It's Katie Harris, owner and CEO of Nursepreneurs, and I'm very, very excited to bring to you guys today Avexia's Health Solution. We're going to be talking about hormone therapy, hormone optimization, and bringing this into your practice, which is exactly what I did. I love this group, and so I'm really, really excited to share this with you guys. So Lee is my practice development specialist, so I'm super glad that she's here with us. And Jordan is the district sales leader. So if you guys want to do your brief intros, and then we'll get started.
Perfect. Lee, I'll let you take it first.
Thanks, Katie. Yes, my name is Lee Klein. I am a product development specialist. I work hand in hand with Katie. I am maybe about a year with Avexia's Health Solutions now. Fantastic, all-consuming company with education, peptide therapies, nutraceuticals, but we're going to let Jordan go through all that for you. My background is I am a nurse by nature. I have been a nurse. I have my master's in nursing, started to learn more things about healthcare and actually fixing problems instead of band-aiding them. So got involved with Avexius, and it really drew me in. And this is my path. This is where I want to head. So, and continue forward. So I invited Jordan, who's been with the company much longer than I, and she has done presentations in the past, and I thought she'd be a great addition to this meeting. So here's Jordan Rodriguez for you.
All right, thank you so much. Yes, my name is Jordan Rodriguez. I am the district sales leader for Florida. I know Lee's kind of in the Northeast, so we got kind of a dual combination here. But yes, I've been with the company for 3 years, also extremely passionate about all things preventative medicine. And we're very unique with offering not only the medical and clinical solutions, but also the full business implementation and business solutions that you really need to just be able to launch these type of therapies into practice. So been with the company for 3 years and just have had an amazing time with networking with different providers and helping them launch these type of therapies in their practice. So we thank you for having us. And yeah, we'll kind of get started whenever you're ready.
Yeah, definitely. Go ahead and take it away.
All right, perfect. So kind of what we are, like I mentioned, we are all about preventative medicine. We want to really be in this movement and this motion of getting away from sick care. And I think a lot of providers are in that same mindset of we're tired of the Band-Aid effect. We're tired of not getting to the root cause of what's happening with our patients. They're presenting with all of the same things on a consistent basis, but what are we missing as far as screening and management to actually help them get to that root cause? So I love this quote: the greatest medicine of all is teaching people how not to use it and how not to need it. We're not Ambien deficient and we're not Adderall deficient. We're likely some type of hormone is imbalance. And that's what's kind of getting us to feel the way we're feeling. So today's conversation is going to be really a 100,000-foot overview of what we do, because we do a lot in this space, but it's going to give you more of an idea of our current health crisis and kind of what Avexia's Health Solutions is doing from A to Z to help providers enhance patient care, but also, create recurring revenue and really get out of this vicious cycle of insurance models and things of that nature. Now, I'm not saying that, big pharma medications and insurance models are bad, because they're not, and they definitely have a place in healthcare, but there has to be a better way. And that's kind of what Avexia's Health Solutions is doing. So before we get started into all of me speaking and you guys just get drowned out by my voice, we're going to go ahead and just play kind of who we are, what is our mission, what do we do here at Avexia's Health Solutions, and a little video to kind of put that into just a good idea of what we do, and then we'll get started.
Our whole vision and mission as a company really is to radically change healthcare. Every single human on the planet is designed with a unique gift that they were born to give to the world. And when you don't feel well, you're not able to show up in that gift.
13 years in private practice, doing everything that I was taught to do, I realized, wow, people aren't very healthy. We're just waiting until they get sick and then giving them a prescription of some sort. There has to be a better way.
At Avexia's Health Solutions, we are focused on clinic and we're focused on patients. That's what gets me out of bed every single day, because I'm like, we know that what we're doing works. It's real medicine. And when you go out there and you make that change on a daily basis, it's very rewarding. And it's rewarding for our practitioners. It's rewarding for patients all the way around.
Our practitioners are incredibly courageous, doing something that they haven't been taught traditionally to do, and they need a community and network. This is a full medical and a full business support, and it takes both sides of that, and that's precisely why we assign a practice development specialist, so that they get good at the medicine, they get good at the business.
I was just really close to closing. We came back and we implemented everything that they told us to implement, their training. Within 2 months, I was back up. Financially, I was back in a good spot.
If we can help providers be successful in implementing therapies that at their root can reverse many chronic diseases, we're taking a step forward in that mission.
It all starts with patient and patient outcomes. We are focused so intently on patient result.
Because of Avexius and because of the treatments, I believe I'm a better dad. I believe I'm a better husband. I really just believe I am who I'm supposed to be and living in that vibrancy because of the treatment.
With Avexius and Avexipel and Pharmakeo, our entire family of companies, we really take a much more integrative and a holistic approach as opposed to anybody else that's out there.
If you are a practitioner that's getting ready to go through our training, buckle up. You're going to be really excited at the end of the day of what's possible.
I went into medicine wanting to help people. Once I started with Avexius and I started implementing the things that I learned, and people actually started getting better and not just Band-Aided, I finally was satisfied that, okay, this is what I came into practice for.
So that is a 100,000-foot overview, again, of kind of what we do. And Avexius Health Solutions, we are extremely unique in the marketplace. I like to say we're a three-headed monster, and that is because we're not only the medical training and all the business solutions, but we're also the trusted compounder. So everything that you need from peptides to the actual pellet itself, we have good quality third-party tested products. So we're able to kind of be that extra vendor in your journey when launching peptide therapies and hormones and things of that nature. So we'll dive a little bit deeper into some of our sister companies here soon. But really to start is kind of understanding who we are and what our mission is and what is our current health crisis, because we know that America is not a very healthy population at the moment, and we know that a lot of chronic diseases are on a hockey stick increase right now. And so what are we doing to help solve for that? So really starting with Avexius Health Solutions mission, and our mission is to positively impact people's lives through the advancement of medical wellness. So I like to call it modern medicine. We're getting away from this traditional Western medicine. Again, not saying that it doesn't have a place, but we're kind of transitioning into this more preventative medicine mindset, which is phenomenal. Now more than ever, after COVID happened, people are considering their health. And now more than ever, medical providers are reconsidering their approach to medicine. I think a lot of providers nowadays, and a lot of you that are sitting on this call, is sometimes we have that moral injury of, I know I shouldn't necessarily be doing this because it's not in the best interest of the patient, but I'm in a situation where I don't have that ability to go outside of what I'm able to do, whether that's in a hospital group or whatever that may be. We know that market conditions with insurance reimbursements are an absolute disaster. We know that you guys are having to see more patients, write more scripts, order more labs, and make a lot less money. So revenue and those cash-based therapies allows a different avenue for that. And the last thing, and the question that we should be asking, is how can and how does bioidentical hormone replacement therapy solve for the patient and also the practice? Because we know that patient is number one focus. We want to make sure that they are feeling good, that they're living a healthy life, that we're preventing chronic disease progression, but the practice also matters too. You have to keep the lights on. You have to pay your team. You have to pay your staff. You have a family, put food on the table. So it's a benefit and a win-win for both the patient and the practice with what we're doing here at Avexius. So when we look at the current health crisis, again, disease and sickness is hockey stick increase. So the patients, when we look at the patient population by 2050, 13.8 million patients over the age of 65 will be diagnosed with Alzheimer's disease. Is Alzheimer on a increase or is it on a decline? It is increasing like no other right now. Alzheimer's is being known as the type 3 diabetes. Today, 1 out of 3 Americans are diabetic or pre-diabetic. Over 100 million people in the US. That's a startling number, and it's continuing to get worse and worse and worse. 1 out of every 4 deaths is related to heart disease. 735,000 heart attacks a year. And a lot of that is, okay, are we looking at the different areas of health to show that we could have potentially prevented a lot of these chronic disease progression? You know, osteopenia, osteoporosis, toxicity. When we look at cancer, is cancer on a increase or a decrease? It is on a hockey stick incline. Cancer rates and cancer mortality is on its all-cause high right now. And we have to step back and kind of look at what is causing these things. Now we know, again, we don't live in a very healthy world. The food we eat has hormone disruptors. The shampoo that we put on our body, the hair wash, the toothpaste we use has toxic ingredients in it. So we don't live in a world where it makes it very easy to live a toxin-free life. But there are ways that we can really help work with our bodies and try to, prevent some of those things from impacting our daily lives. So out of all the chronic disease progression, now patients are presenting with all of the symptoms. So how many patients walk through the door and say, I can't sleep, I can't focus, I can't think, my memory is non-existent, I have the worst joint pain, I'm depressed, I have so much anxiety, I have belly fat, I'm gaining weight, I can't lose weight. And I mean, the list just goes on and on and on, because those are the consistent things that your patients are coming in and bringing to your attention. Now, the thing that we have to look at is, are we screening these patients for the proper things? So starting very, very basic here, and a lot of you may already know this, and some of this may be new for you, but what are hormones? Starting really basic, that they are the chemical messengers made by the glands that act to control certain actions of the cells and the organs. So they're basically our communicators, they're our messengers. So I like to use the analogy of a cell phone. I mean, we're in 2024 where we can't go drive down the street or drive on a road trip where we don't know where we're going without using a GPS. Or if we have to send or receive a message, the only way we really know how to do it is from our cell phones nowadays. Could you imagine if we didn't have our cell phones to send the proper messages and controls to tell our body to do what it needs to do? So that's kind of what the hormones are. When our hormones are out of whack, we're not in homeostasis, we're not in balance. So we know that hormones play a massive role in overall disease prevention, health management, vitality, and just overall homeostasis within the body. So kind of the main hormones that we talk about is testosterone, estradiol, so 17-beta estradiol or estrogen, progesterone, the thyroid hormone, vitamin D. There's a lot of hormones that we could talk about, cortisol, DHEA, but the main ones that we talk about, or we know a lot about, are sex hormones. So testosterone is a massive part of what we kind of stand on. And I think one of the biggest myths and misconceptions is that it's just a male hormone. Only males need it. Females are going to turn into a guy and they're going to be Superman and fly away. That is just not true. Testosterone is also just as much of a female hormone as it is a male hormone. And really, it's the most abundant active hormone in both men and women. For women, we have the most testosterone receptors in our body over progesterone and estrogen receptors. So when we talk about testosterone optimization, this is not just for males. If anything, females need this just as more as our males do. So we know that it's the most abundant active hormone. It's derived from the ovaries, testicles, and adrenals. It acts at a cellular level with direct effect on the androgen receptor. So we have androgen receptors across every part of our body. It is a precursor for DHT and estradiol receptors as well. So benefits. So when we talk about benefits in men and women. Testosterone aids in the prevention and the treatment of coronary heart disease. So when we talk about, heart disease and CAD and all those kind of heart issues, we need to step back and take a look. Okay, what is this individual's testosterone level setting at? And that's something that we don't get pulled on a normal annual lab visit. So we tend to draw a more comprehensive set of labs to really take a look at some of these other levels that could be contributing into why a man has sleep apnea or a female has hot flashes or whatever that looks like. So it helps in the prevention of Alzheimer's, prevents depression and mood disorders. It can actually prevent prostate and breast cancer. And breast cancer, right? I think that's one of the main things with hormones is from the Women's Health Initiative, we heard all about breast cancer. It causes strokes, it causes blood clots, it causes all these side effects, but they were talking about synthetic hormones. When we talk about bioidentical hormones that actually match what our body produces, so testosterone, 17 beta estradiol, micronized progesterone, things of that nature, we're actually able to prevent breast cancer. There's a phenomenal study by a surgeon, Rebecca Glazier, out in Dayton, Ohio. She actually utilized testosterone pellet implants and an anastrozole. So she did use an AI, but she was able to reduce a tumor mass with testosterone pellet therapy. So in 16 weeks, she went from a massive tumor mass and reduced that to virtually nothing within 16 weeks of testosterone therapy. So when we talk about cancer, that's another misconception that we hear is that it's going to cause breast cancer. In reality, when our levels are optimized, it actually prevents from prostate and breast cancer. That's a little tangent onto the next, but sexual dysfunction, it can prevent diabetes and insulin resistance, prevent memory and cognitive decline. So it helps with our overall cognitive function. And of course, chronic and acute pain syndrome. So a lot of pain management doctors have been realizing that testosterone optimization and really hormone optimization is standard of care for some of their pain patients. Testosterone plays a direct role with overall pain threshold. So when we have decreased testosterone levels, our pain threshold also decreases. If you have patients that are on opioids or on hardcore pain drugs, that also suppresses testosterone levels, which suppresses the pain threshold. So testosterone is a valid option for standard of care when it comes to pain patients too. So kind of the androgen receptors, where are they found? Like I mentioned, they're found from the top of our head to the bottom of our toes. So hair follicles, skin, scalp, thyroid, cardiovascular tissue, breast tissue, uterus, GI tract, and the list just goes on and on and on. We have androgen receptors all over our body. So when we look at our current health crisis, the bad news is all of our hormones are on the decline and it's getting younger and younger and younger. So we would see, people start to have hormone issues within the 30s, 40s, 50s. They start hitting menopause, things of that nature. Now we're starting to see those declines in 18-year-olds, 22-year-olds, 25-year-olds going into those year 30. So when we look at our hormone levels, it is on a massive decline right now. Men ages 30 through 70 will lose about 1 to 10% of testosterone per year, and women lose about 50% of production per year after the age of 30. That is massive. 50% production is lost per year after the age of 30. And that is, again, continuing to get younger. So that is actually decreasing a lot faster than what it typically would. When we look at optimal testosterone level, lab ranges for females, that can sit anywhere between 80 and 150. Now, everyone's a little different. Someone may feel great at a total testosterone level at 80. Some females may feel phenomenal at a total testosterone of 150. So everyone ranges a little bit different, and that's going to go based off of how the body absorbs it. That's going to go based off of dosing. Are there other avenues like thyroid optimization, vitamin optimization that we can kind of play around with to help with those levels as well? Optimal testosterone lab ranges for males is anywhere from 800 to 1200 plus. And again, that varies. One male may feel good at 800 and another male feels the best at 1200. So that's going to vary based on patient symptoms and how they're feeling. And not only does age cause a decline, but like I mentioned earlier, is our food, our environment, our toxicity, any type of injuries we have start to play a role into why our hormones are starting to be on a decline very quickly. I absolutely love this resource. This is a great tool to be able to use in practice when you're kind of offering this and giving them a good visual of what this looks like when our total testosterone levels are below a certain number. So this is a study that was completed in 2006. On the left side here is showing the total testosterone level for young males. So that is the total testosterone level. If you take off a 0, that is for females. So that would be 10, 20, 30, 40, 50 instead of the 500. So on the right side here, you're going to see all of the chronic diseases that are on an all-time high right now in the United States and across the world. So when we have a testosterone level of, let's say it's 231 total, all of these on the right-hand side start to increase. So we know that when a male has a testosterone level of 200, he's likely experiencing ED. And most of the time, once males hit this point where they are experiencing ED, that's when they finally come in and say, oh, something's not right here. But we could have prevented that if we were consistently pulling the right panels in their labs. And that could have been just a simple testosterone level. So when we have our levels in a lower limit, all of these start to increase. So ED comes present, depression is present. They likely already have some type of coronary issues, maybe some heart issues, maybe COPD, sleep apnea, some of those things that we see, metabolic syndrome, Alzheimer's disease, type 2 diabetes. When our levels are lower than this upper limit, we have risk for all of these things to start to rear their ugly head. And that's the same exact thing for females. When we're below a certain level, we increase our risk for all-cause mortality and chronic disease progression. So what if we did screen that patient and we were able to catch that before they got down to 500 and they were diagnosed with type 2 diabetes? And so that is our goal here, is we want to go into that preventative medicine mindset and that preventative medicine model. So understanding the foundational role of HRT in health. So this is huge, because even if a patient doesn't necessarily show symptoms or show that they may have imbalanced hormones, they may very well be threatening their health. So I love using this story. Our executive vice president, Jeff, his wife, Tiffany, she likes to call, I don't know, positive Patty or positive Pelly. She is just such a positive individual. Nothing can shake her, break her, ruin her mood. She always has a smile on her face, always has a pep in her step. And you would think that her hormones were through the roof and she's 18 again. Well, the thing is she had a history of Alzheimer's disease in her family. And Jeff was like, just go get your labs. Even if you don't have symptoms, let's go get your labs checked. And let's just see if there's anything there that could be potentially, of cause or of concern. And what happened? She came back and her testosterone levels were non-existent. They weren't even able to show up on the labs. And so though she didn't have any symptoms, or she said she didn't have any symptoms, she finally got optimized. And it's like this fog came over her, because even though, again, she didn't have the symptoms, she still was dealing with those things. So just because we're used to how we're feeling doesn't mean that we're optimized. Just because we're normal does not mean we are optimal. We can feel better and we can prevent a lot of these things. Many patients with low testosterone and estrogen don't experience the common symptoms and assume they don't need therapy. So this is a dangerous assumption, considering that we know hormones are almost every receptor in our body, and it plays a massive role in preventing diseases such as osteoporosis, cardiovascular disease, Alzheimer's disease, certain cancers, and so on and so forth. So we know that optimal hormone levels reduces all-cause mortality and reduces chronic disease progression. We know that hormone imbalances occurs in all genders. So testosterone is not just a male hormone. Estrogen is not just a female hormone. Hormones are not just for moodiness and hot flashes and ED. Hormones are also for cognitive regulation, joint pain, weight loss, helping with anxiety and depression. It is so much more than just the moodiness and the hot flashes and the ED. Hormone replacement therapy is necessary for men and women of all ages for vital and healthy living and disease prevention. So The question we ask now is, why is not every patient screened for some type of hormonal loss or imbalance? And there's really two main reasons. And that first reason is lack of medical training. Medical providers weren't taught this in medical school. So even if you knew that they had a hormone imbalance and you screened them for the labs, we don't necessarily know what to do past that. We don't know how to actually manage that patient. So we can screen them. And even then, a lot of providers don't feel comfortable screening for hormones because they don't know the next steps from there. So that number one reason is just providers and practitioners were not taught this in medical school. I think another number two, kind of that second reason, is societal myths and medical misconceptions. So like I mentioned earlier, HRT causes cancer, causes breast cancer in women, it causes prostate cancer in men, and it increases risk of heart attacks and blood clots and strokes and all of these things, anabolic versus human versus bioidentical. Those are two completely different categories. And that is just a lot of confusion in day-to-day life for both women and for men. So a lot of myths and misconceptions revolving hormone therapy is starting to be debunked more and more as we kind of start to make this standard of care. So what do we know? Hormones are foundational to our health. They are the chemical messengers that allow our body to achieve homeostasis. Loss of hormones increases your risk of disease and sickness, and actually giving hormones decreases your risk for disease and sickness. Optimized hormones are necessary for both women and men of all ages. And bottom line is, we all need our hormones checked. Even if you don't move to the next process of getting optimized, we still need to know where those levels are so that we can prevent a lot of these things from happening. So now you must decide, where will I receive this training? Where do I receive ongoing education? Where will I receive clinical support? What happens if I have a patient case and I just don't know what to do or what the best next steps are? Who am I able to reach out to from a clinical standpoint to help me walk me through that patient case? How will I implement these therapies into my practice? We know that there's a lot to go into it when it comes to implementing these type of therapies. How are you going to dose? How are you going to record your inventory? How are you going to market to your patients compliantly? How are you going to be able to help screen your patients in your current database? How are you going to educate them? Where are your products going to come from, right? All these questions start to happen. All your paperwork, your consent forms. We offer that to you. I like to say a business in a box. You have a trusted compounder. We're able to help with that too. So that kind of goes back to, we are this unique three-headed monster in the marketplace. So when we talk about HRT delivery methods, how are we going to deliver the hormones? We have different ways and different modalities to be able to do that. Avexius and the AvexiPell method really highlights pellet therapy. We've been able to really solve for some of the main concerns that come with pellet therapy, which we'll go into here shortly. But you also have the injections as an option. We know that those are synthetic. Creams, you have bioidentical and synthetic options, as well as orals. You both have bioidentical and synthetic. So kind of highlighting the subcutaneous pellet implants, because when it's done right, this hands down is the superior modality to get your hormones. And the reason why is, one, it is the longest studied modality. So this has been around since the 1930s. Pellet therapy has been a delivery method since the 1930s, and there's tons of literature from then all the way up to current day of 2024. We do know that they are plant-based, so it's all plant-derived, typically yam or soy, most of the time yam. So it is all plant, and it matches what our body naturally produces. What's really nice too is you're getting the continuous levels over 3 to 5 months. So for females, they're able to get 3 to 4 months worth of symptom relief. So they come in about 3 times a year, and then males are able to come in only twice a year because they do get a little bit more dosing, a little bit more of a higher dose compared to females. So what's nice about that is you're increasing the compliance, you're increasing the convenience for the patient, and that patient is going to get continuous symptom relief based on the body's output. So when they're blowing and going through the day and they're in, their busy work day and that blood is flowing, that's when they're absorbing the pellets. When they're sleeping at night and that blood is not pumping as fast, they're not absorbing as much hormone. So it is mimicking your body's natural kind of endocrine process. So It's a great way to deliver those and match the body's process. It's the longest therapeutic window. So with creams, you have a very, very long, half short life. My goodness, I'm getting my words tied up here. But for creams, you have a short half life. So you have to rub a cream on, they get 6 hours, whatever that may be, and then they have to reapply that again. So you start to decrease convenience, you decrease compliance because they have to rub a cream on, and now they have to remember to consistently do that. Another thing with creams and gels is our body sometimes won't absorb the dose that is being prescribed. So if a patient is, putting it on the inner thigh and not doing necessarily a kind of labial application, or if a male is not doing a scrotum application, then it may have a tough time absorbing. And with injections, we know that you kind of have that roller coaster effect. So you inject, you shoot up really high, and then you crash back down. Now, we typically see more males on the injections. We don't typically train on giving females injections. There's just better options for the females. But with males, you just that kind of roller coaster effect and not having that consistent hormone delivery can bring side effects and some other issues that we don't want to have. And then dosing is more individualized. So with injections or creams and patches or even orals, you have your set doses. And you can't really go outside of that. Now, of course, you can adjust that dose because you're doing a cream or you're doing an injection with pellets. You can't take the pellet out once it's in. But when you get dosing right, you don't have to worry about the concerns of uneven absorption or too much being absorbed. So the dosing is a lot more individualized because it's going to take into consideration the patient's name, date of birth, height, ethnicity, weight, but also all of their medical history. Are they a chronic pain patient? Are they currently on hormones? Are they a breast cancer survivor? So it takes in some of these key medical history points in addition to all of their lab data and all of their symptoms and activity level. So based on all of that data that's placed into this dosing algorithm, it's going to give you a very conservative dose for testosterone if that patient needs it, estrogen if that patient needs it, and it even takes it a step further to give you dosing protocols for thyroid. May that patient need thyroid, supplements, so vitamin D, B complex, probiotic, whatever that may look like, as well as like DHEA and progesterone and some of those key pharmaceuticals that we know play a massive role in overall treatment plan when it comes to hormone optimization. So you just get more of an individualized dose for those patients based on a lot of different parameters. So that dosing protocol and that dosing algorithm is taking into account 4 million different permutations. So you're getting everything very, very concise and individualized for that patient. And kind of to go to Pharmaceo outsourcing. So that is our 503B FDA registered outsourcing facility. So that's specifically where our patented pellets come from. So we know the dose is the difference between poison and medicine. And so that's why we offer you the dosing algorithm to really stay conservative and stay in the guidelines of what is safe and efficacious for your patient. Another thing is we guarantee a potency with a plus or minus 3% variance. With brand medications, those brand medications can be up to a 10% variance, meaning if you're prescribing 100 milligrams, your patient is either getting only 90 milligrams or they're getting 110 milligrams. And on generic products, that can be up to a 20% variance. So again, if you're prescribing 100 milligrams, that patient is either being underdosed at 80 milligrams or they're being overdosed at 120 milligrams. So when we talk about potency and variance, we keep our products very, very tight. And really, we know that we take this a step further, and it's really a plus or minus 1% variance. So you know exactly what you are prescribing your patient is exactly what your patient is going to get when they start on their treatment plan. So how does the Avexipel method work? So really first step is we have to screen the patient. So we use a validated screening tool. We have this in 30 different language, and it really is asking different questions. Are you gaining weight? Do you have anxiety or any cognitive issues? So it goes through these different questions and rates them from, I don't deal with this at all, to this is extremely severe and I need help. So that symptom checklist is going to really be a guide to help you screen your patients and see if they're a candidate. Step 2 is to get the labs work. So we can't do anything without labs drawn. So we use a very comprehensive lab panel just to kind of see where they're at first. So really can't do anything without screening the patient and getting a comprehensive blood work panel done. From there, the patient will come in, you'll do a consultation. You'll be able to input all of their data into the dosing algorithm. So this is a lot of data that it takes in. And the more data you put in, the more individualized that's going to be for the patient. From there, if the patient wants to move forward with the pellets from the delivery method, you're going to be able to do the pellet insertion right there while they're in practice. So our goal for our business program is to give you everything that you need from A to Z when it comes to marketing, paperwork, product, insertion device, literally everything that you need to be able to treat that patient while they are in the clinic. Then that patient will get 5-week labs, just kind of a very small post-lab panel to see where they landed. And from there, we'll be able to make adjustments and kind of see if we need to tweak any of their treatment plan. So it's a very simple process of screening the patient. We're going to get some labs drawn. We're going to have a consult to really break down the labs and see exactly what's going on. And then we're able to treat the patient and they come back in for that 5-week follow-up. If they're good to go, they'll see you back in 3 to 4 months for them to be repelleted. So it's amazing because it's bringing that patient in again to where you can really manage them the way that you like. So there's a lot of different companies on the market. There's a lot of different compounders on the market. So what makes the AvexiPel method really just so different? And really, it kind of stands on 3 things. First thing is our dosing protocols. So very, very conservative and safe and efficacious for the patient. We don't ever want to get a patient to have side effects or a patient to be at these super physiological levels. We want a patient to be at an optimal level to where they feel good. Innovative patented pellet formulation. So we are the only patented pellet on the market. And so you have to have a product pretty unique to gain something of that magnitude. So we actually have been able to blend a very, very, very small trace of triamcinolone, which is an anti-inflammatory, into our testosterone pellets. So what that's done is it's actually reduced scar tissue, it reduces the inflammation, and it keeps that incision site nice and happy so that a patient can have a more comfortable experience. When you kind of pair our patented pellet with our proprietary insertion technique with our new trocars, we're just optimizing the patient experience so that there's not many issues that the patient has to deal with. So with our proprietary insertion technique, we don't do it how it was typically trained. So kind of with the industry, and again, providers on here, you may be kind of familiar with pellet therapy, and others, this may be very new to you, but typically how it would be done in the industry is they would kind of take the trocar with the sharp end and they would do a kind of a twisting cutting motion. Well, we know when we're cutting tissue, when we're cutting capillaries, we're going to create trauma to that site and it's not going to be very happy. And then what happens when we cut tissue? Scar tissue buildup starts to happen long term. So now patients can't be on this therapy for a period of time because they're starting to deal with some of the side effects with the insertion. So we actually train on more of a less traumatic insertion technique. So we no longer cut tissue. Our trocars do not have a sharp end. So it has more of a conical tip. So I like to think of a cannula on the face, very, very blunt. So you're going to just weave through the fibrous fat bands, lay those pellets in the subcu area, and you just use a steri-strip to kind of enclose that little incision, and they are on their way. So faster healing times have been observed. And what we notice is patients are actually able to extend their therapeutic arc based on the way that we insert them. So the pellet itself and the medicine has changed dramatically because we've been able to solve for uneven absorption. We've solved for extrusions, and we've solved for the pain and some of those things that you deal with. So enough about the clinical. That's a massive part of what we do. Now, the other side of that coin is how are we going to implement this? Because what is nice is we are going to offer that 2-day initial training course for you to come learn about what the medical literature says and how Avexius does it with the AvexiPel method. But then we offer you ongoing support and ongoing training solutions as you are partners with us. So I love this tagline of we're all about providers who are all about patients. We want you to help your patients. And when you help your patients, you will do good as a byproduct. So with Avexius Health Solutions, we're more than just hormones. And I know that I've talked a lot in this webinar, but we're more than just BHRT and hormone optimization. We also offer integrative solutions training, which is targeted protocols leveraging peptides, compounded prescriptions, so like low dose naltrexone or oxytocin, thyroid medications, things like that, as well as supplements. So we offer a wide range of 30, I think we're at 35 different pharmaceutical grade supplements. And so we actually offer that to you guys to be able to hold in clinic if you want to hold inventory, or we have an awesome auto ship portal to where you can drop ship these products to your patients and collect a little bit of commission on that. We know with supplements, people are buying them from Amazon and GNC all day long. So why not keep that business in-house and actually give them a product that is good quality and pharmaceutical grade? So we offer training on hormones, hormone optimization, supplements, peptides, and compounded prescriptions. So we offer it all, one-stop shop. So really kind of your first steps is, like I mentioned, is to come through a 2-day training course. That's really your initial training with us. So once you are kind of onboarded into our system and you pay your initial training fees, you're able to come through any one of our trainings free of charge. And you can also live stream any one of our trainings free of charge. Now, the integrative solutions training is a separate course, so that will be a separate charge. But anything related to hormone optimization and supplements is all included in that initial. So we want to be able to give you that initial training, but also ongoing training and ongoing education, because we know when you come in for those first 2 days, you're not going to be an expert or, know the art and science about hormone optimization. It's going to be a continuous kind of journey of learning the literature and learning the art and science behind hormone and hormone balance. So you'll come through a 2-day training. It's developed by an amazing team. So Terry Denai, don't know if you all know him. She is our founder. She does a lot of our lectures at our 2-day training courses. She's this lovely lady here. And then we have Dr. Johnny Pete, who is also one of our amazing trainers and does a lot of our conversations. Dr. Laval, he is our integrative solutions training. So he does a lot of our peptide trainings, integrative solutions. He just did our weight management GLP-1 course that we had back in July. So he is also on our medical board, and he is just an expert when it comes to functional medicine, regenerative medicine, and so on and so forth. So WorldCast live training, you will come out to Dallas. So it is a 2-day training in Dallas. And then you'll also have access to our Avexius online platform, where you'll have hours and hours of webinar videos and continuous education. So strategic partnerships, like I mentioned, we are a 3-headed monster in the marketplace. So not only are we going to be able to train you, but we are also the trusted compounder. So everything that you need from a custom compounding perspective, that will come from our 503A custom compounding pharmacy. So Pharmakeo is our pharmacy network. We have the compounding side that does all of our peptides, patient-specific compounds, so your thyroid, progesterone, things of that nature. And then our 503B outsourcing facility is our FDA registered facility. And that's where our patented pellets are formulated and they ship out in bulk to our patients. So we have 2 different pharmacies to be able to supply what you need and what you're looking for. So like I mentioned, the variance is extremely tight. We do offer shipping, free ground delivery. So that is included in the pricing already. As an Avexius provider, you do get an additional 5% discount on all products. And we have a very, very wide formulary. So we offer thousands and thousands of different products and are able to custom compound things depending on what you need. So top peptide products, we have the semaglutide, we have tirzepatide, PT141. We also have sumarilin and glycine, and then some of those other non-sterile products like your MP thyroid, micronized progesterone. We do offer that as well. 503B FDA registered outsourcing facility. Again, this is only where our patented pellets are formulated and then bulk shipped out to our providers. So setting you up success with Avexius. So again, I mentioned that we are a business in a box. So instead of having a piecemeal everything separately, we kind of offer you a full program to launch from A to Z. So we're going to provide you the proper tools and the resources to identify patient candidates. So our goal first is to cast a net over your current database and kind of start to treat those first, because this is a therapy that is all word of mouth. You treat one patient and they have a phenomenal result. On average, they refer 7 new patients to your practice. So this is a great therapy to make as a foundation in your clinic and to really help grow, because you'll start to get a lot of word of mouth. We also will provide compliant marketing and patient education. So we have different banners and posters with customized QR codes on there directly correlated to your practice. So when a patient scans it, it has your practice name, provider's name, and it has all your practice data. And then we're also going to walk you through patient flow processes for both existing and new patients with some of our tools to kind of help streamline that process. So again, our program is designed to do these main things. With our tools and strategies, we're trying to help you attract new patients in addition to screening your current patients in your database. When we attract patients, we're going to teach you how to manage. So manage is all of the support we provide you from a clinical perspective. How are you going to manage breakthrough bleeding or whatever may happen with that patient once they are treated? Do you feel comfortable to be able to manage that patient? And that's where we're really going to work with you and train you and provide you all the resources you need to be able to do just that. And in return, when you attract the patients, you're able to manage them properly, you're able to retain that patient. So we want you to retain that patient and create a lifetime patient for you to where they are screaming your clinic from the rooftops and really inviting other individuals to come into the practice within their kind of network. So we want to be able to provide you all the things that you need to help retain your patients too. And in return, as a byproduct, not only are we going to have happy and healthy patients, they're going to be feeling good, they're going to be telling their friends, but we're going to be able to help create predictable recurring revenue for you as the practitioner. At the end of the day, like I mentioned earlier, is you do well to your patients. As a byproduct, you will do well financially as a provider. And so that's what we really want to help as well, is really break down all the different revenue pillars that you have access to when launching these different programs. So, the insertion itself with pellets or supplements, keeping that business in-house, or cash labs, or your key pharmaceuticals and how to add a tier management fee to pay for your time, little things like that to help you create predicting recurring revenue back into the practice. A couple of different technology tools. So MyVexius, we know that with successful practices, you have to have proven systems and streamlined kind of flows to help it go smoothly. So we have a couple of different platforms, and this is actually all condensing into one platform, which is going to be our Avexius patient care platform. But MyAvexius is more of your day-to-day operational platform where you'll do your ordering, your dosing, your inventory, things of that nature. Avexius Online is more of your education and your paperwork and webinar videos, training videos, and you can also live stream any one of our trainings throughout the year through Avexius Online. Avexius AutoShip is what I mentioned, to where you do not have to hold inventory for nutraceutical products in your practice. You can actually drop ship them straight to the patient. So Avexius Connect and Avexius TV, these are some of our digital marketing resources. So Avexius TV is basically a Fire Stick that we can play kind of looped videos with testimonials, information about peptides, supplements, all the things to help plant the seed and educate your patients on hormone optimization and some of the other therapies. Avexius Connect is where the QR codes. So all the QR codes that are on your banners and posters, they look a little something like this. And those QR codes are going to be customized to your practice. So when that patient scans the QR code, it's going to answer all of their frequently asked questions, and it's actually going to screen the patient as well. So if you're in the back and you're doing an IV infusion for a patient and you have someone in the waiting room who just scanned this QR code, they actually take a symptom checklist. So they'll select, I have weight gain, low libido, joint pain, all the things. And then they put their name, phone number, and email address, and that gets sent to front desk as a screen lead for you. So we're going to have these different resources kind of planted throughout the clinic to help drive patients to want to learn more about this therapy and help screen those patients in the process. So we offer you all of the marketing, the one-handers, the one-sheeters to hand out to your patients free of charge with our partnership. Like I mentioned, Avexius Online, you're going to have your practitioner and PST forums. So this is where you can actually pose patient cases if you don't know best next steps. So if you have it where I pelleted a patient and she's having these side effects and I don't know what to do, you can pose that patient case and our medical board will actually be reviewing that and will give you a more clinical response on best next steps. So you don't have to feel like you're on an island by yourself. It's not just, hey, come through training and good luck. It's come through training and work with us and your practice development specialist to really fully launch our program from A to Z. When you can do that, we can really help you create this as a foundation in the practice and start to get more patients driving through the practice. Advanced lectures, webinars, and live streaming of our events. You'll find all of your paperwork, consent forms, treatment plans, and patient education also in Avexius Online. Like I mentioned, my Avexius is more your dosing, inventory control. You'll order your pellets, marketing material, things like that. And then we have our Life Files portal for Pharmaceo. Okay, I think I talked enough. So it's easy to do business with us. We want to earn your business on a consistent basis. We're not your typical representative that's just going to have you come through a training and then we'll see you later. We have a vested interest to make sure you're successful. We don't get paid unless you are successful. So we want to make sure that you are launching our entire program from A to Z so that we can help you create recurring revenue and really just help enhance patient care. So really next steps from here is I think we're going to be getting a list of everyone. If you are interested, I ask you to either email Katie or I believe Lee is going to be the kind of secondary contact to kind of express that and get a discovery call booked so that we can kind of learn more about your practice, learn more about what you're looking for and how we may be able to help. Not everyone needs a full partnership. So some people may just need to order from our pharmacy, or maybe you just want the nutraceuticals or just the labs, whatever it may be. We can kind of curate a program to exactly what you need for your practice. So our upcoming training solutions is we have integrative solutions training next Thursday. I know that's a little too soon, but we do have our hormone training September 27th and 28th. August did sell out, so unfortunately August is not an option, but we will have September 27th and 28th available. So that's enough for me. If you have any questions, feel free to put them into the chat box and we'll answer them as we can. Thank you so much.
No, that was great, Jordan. Thank you so much. And, just for anybody that's watching this later, because this will be evergreen. Those upcoming training opportunities, they'll just keep moving forward. So, but yeah, gosh, September is coming up so fast.
So fast.
But there's so far, if you guys have questions, please put them in the chat. Like if anybody's doing hormone optimization already, if you're interested, if you have questions. Let's see, Roadrunner here has first asked, where is your 503B facility located? Does your facility also 503A certified? And then asking about pricing for the 2-day seminar training.
Yeah, so our 503B facility, that's the FDA registered facility that is located in Richardson, Texas, as well. So our 503A, we have a Texas location, New Mexico location, and an Arkansas location. So that's all of our compounding facilities. And then our outsourcing facility is based in Richardson, Texas. And so our 503A pharmacies are all credentialed and they adhere by the normal compounding standards. So we are credentialed for all of our 503A facilities as well. And then as far as pricing for the 2-day seminar, that's going to vary based on the practice. We do have discounted pricing for those who are already kind of certified in this side of things. So that's going to vary, which is why we ask that you schedule more of a one-on-one call so that we can kind of curate that for exactly what you need. So I know that's not exact numbers, but it does vary based on the practice and kind of where they're at.
Yeah, and it's a really good deal no matter what.
Absolutely. Because remember, it's not just the training sessions, you're getting everything from clinic setup. So that initial cost is not just you coming through training for 2 days and becoming certified, but it's also everything that we launch into the practice. So we launch about, $15,000, $20,000 worth of material into your practice with product, trocars, the marketing material, all your paperwork. So all of that is included in that initial training charge. Pharmacy shipped to all 50 states. So our Richardson location is in all 50 states. Our New Mexico location is only in 12 states. And then our Arkansas location, I believe, is 10 states. So we can get a list of those and kind of where we're at. But our Richardson location is in all 50 states.
Yeah, I mean, the trocars were a big deal too. There are like disposable ones out there, but I mean that just adds a cost. And when I found out that you guys had stainless steel trocars and they're just free, I was like, oh.
I was like, are you sure it's free? What's the
I called Lee and I'm like, am I going to get like $1,000 charge on my
right?
She didn't believe it. She's like, is this right? Wait, tell me again.
No, and that's why it is so incredible for what we do. We literally give you a business in a box. And so how our kind of program works is we do submit a report twice a month. And so however many female and male pellet procedures you completed within those 2 weeks is what we will invoice you for our services on the back end. So it's a very cash positive model. You're collecting the money from the patient before we even charge you for everything that we invested into your practice. So we're taking a massive gamble. But at the end of the day, it's designed to help you have everything that you need so that you have a streamlined system and we can help you grow this and make this a foundation in your practice. So
yeah. I mean, the other thing that I, really like too is that, I mean, you do have that marketing section, and I actually just ordered some more like, you have these little booklets, and there's even booklets in Spanish, which is really nice because, I have a handful of people that come in and it's hard to communicate with them. But, there's the English, the Spanish, there's folders, and all of that stuff is free, which is amazing. And, the pellets, that all comes to you. There's not an added expense for that. So I can order testosterone and estrogen, and just what I need when I need it, which is awesome. And that all comes, you pay for the training, but like you said, it's a business in a box. So, it's not technically free, but I can order as much as I want, right? And then the other thing that I really liked is that Terry had written that book, Hormone Havoc. And I ordered like 10 copies to start with, and they were like, I don't know, $5 each. It was super cheap. And what hand those out is like, when people come in for their initial consult, just to give them an overview, because it's like, I was trying to put all this stuff together myself. And I'm like, oh my goodness, this is exhausting. But for $5, I can just give them Terry's book and, read this and get back to me,
Yeah, that is honestly, if you guys want to write that down, Hormone Havoc by Dr. Terry Denai. She is phenomenal. The book is so phenomenally written. It's not only a good read for providers and those that have more of a clinical background, but also patients. It kind of is easy to digest from a patient perspective as well. So it can kind of touch both areas of providers and patients. It debunks every myth and every misconception that we've ever known about hormones. And it just is a good guide and to help you advocate for yourselves, because there's a lot of misinformation out there. So we've got to, do our own research. We've got to advocate for our own health. And by doing that is reading these type of different books and stuff to help you educate yourselves. So it's a phenomenal book. You can get it off of Amazon, Barnes and Noble. It's like $20. If you're close to Katie, she can give you a book too. But, it's a phenomenal read and highly recommend reading that if you had any questions on anything with hormones.
Yep, definitely.
Can we put our company on the
nutraceuticals? I guess we label it.
As of right now, it is just the Avexius label. There could potentially be some discussion about private labeling based on volume. But as of right now, it is just the Avexius labeling, but there could be conversation to private label based on situation.
I did want to add that when Katie put in her order for more marketing materials, because I work directly with Katie as her product development specialist, I got an email telling me Katie ordered some marketing materials. So that's how connected we are with everybody that we work with.
I love it. I love it. So Jay tells him, what if I'm a franchise? Can you still work with me? Yes, we work with franchises all the time, because basically all we're doing is we're helping you kind of create a streamlined process for this service that you're going to be offering in your franchise. So it doesn't, work against it. More than anything, it will help streamline that additional therapy. So yes, we can.
So this question is, it looks like for me, I've started my practice in January, and prior to that, I had started with hormone therapy with a different practice, like a different group that does this, and it wasn't the same level of support. And because I'd never done hormone therapy before, it was very kind of like I felt thrown to the wind. And I had my first conversation with somebody, and it was so like I just didn't feel right about it. And then when I saw Avexius, and I had gotten a lot of recommendations to go through Avexius, and I'm like, oh, I'm already with this other company. But come to find, and a lot of them make you sign like one of those non-compete, which is ridiculous. And then you can never leave them. But Avexius can work with you with that, and I've been using them for the last 6-7 months. Has it been? I see generally more women because I do perimenopause stuff, but I've gotten a handful of men, and they love it.
Yeah, absolutely. Let's see. Does your system integrate with Zenoti for CRM in the office? So we are kind of coming in. As of right now, it does not. So right now, our Avexius Care platform is really going to be it's kind of going to be your EMR for your hormones, peptides, and supplements. That's kind of what it's designed to do. Now you will be able to download reports. And if you want to kind of like upload that, it's kind of double the work. But the Avexius Patient Care platform is going to be designed to have all of your treatment plans, supplement orders, GLP-1 programs, consents, everything all within one platform. So that's kind of what we're going into. So at the moment, it doesn't integrate with outside CMRs because we're kind of coming up with our own kind of EMR system for specifically the hormones and the peptides and things like that. So that is a no.
And I would just add to that, like, in my practice, because there's that dosing calculator as well, which is really nice. And so what I do is go in, get the dose. So I input all the labs, and it's kind of like Quest. Quest doesn't seem to integrate with anything either. So I have to download the labs, then I upload everything. I use Jane. So I upload everything into Jane, and there's usually just somewhere you can drop the files. Then I have the dosing, why I dose that way. I have their labs, and then everything's centralized in one area, but they make it pretty easy to do all that kind of stuff.
Absolutely. And it's going to get easier. So as we start to roll out the Avexius Patient Care platform, that is going to just streamline that process that much more. So it's only going to get better.
So what about QuickBooks?
QuickBooks, that I do not know. I would have to dig a little deeper on that question. So we'll work on getting a response to that.
Okay.
I want to say no, but I'll ask just to confirm.
Yeah, I mean, it's one of those things that you want to have an EMR that can do absolutely everything and run your practice, even parts that aren't like, but it's like, I've never seen a system that can do it well anyway.
It's hard, which with the Avexius Care platform, which is what I was just mentioning, that will allow you to run those reports, and it really will do kind of your accounting for you as if it is QuickBooks. So again, we're kind of getting back into trying to have a full EMR system to where it does do all that for you. We may not be able to get everything, but we're going to try to get pretty dang everything, pretty much everything. So that's where we're going with that care platform.
So Lee, do you want me to add your email for them to contact you as a starting point?
Yeah,
yep.
I can put it in the chat here, and then wherever is that good?
Yeah, I think that's a good idea. So if you guys are interested in this, learning more, then you want to email Lee. And this is the only way to get into Avexius. They do one-on-one calls with you. Like other places, you can just sign up and pay your fee and be done. But Avexius actually needs to talk to you and get to know you and your practice, what you want to do, and then you'll talk about pricing and all that kind of good stuff and the next training. So it's a great way to, maintain a high quality, group, and it's very personalized. So
No, absolutely. And that's what it's designed for. We want to make sure that we give you what you need and what best fits your practice, and not, like you said, throwing everything and hoping everything sticks. Some people need other things more than other practices do. So we have a lot of different ways of doing business, which is why we like to sit down and really just break down what you're looking for and then create a package that works best. So yeah, just message Lee. We'll make sure to get you to the proper individual based on where you're at in the state or in the country. So go ahead and email her, and then we'll get you kind of dispersed out to that proper contact. And we hope to see you guys at an upcoming September training.
awesome. Thank you, guys. Thank you so much for sharing this with us today.
Yeah, thank you for
Katie.
having us.
Yes.